we are going to see about the transverse myelitis. So what is transverse myelitis? First of all, transverse myelitis is a neurological disorder. Commonly, this is a rare condition of case. Okay, so it has a prevalence rate and all these things, gender and the male and female affected. All these are very rare condition. First, we will see the definition regarding the transverse myelitis. So it is a rare neurological disorder which affects the spinal cord. First, we need to separate the two terms, transverse and the myelitis. Okay, which we go for here. The term myelitis is referring to the inflammation of the spinal cord. Okay. Next, we are going for the term for the transverse. Transverse refers to the pattern of changes in the sensation. So when we combine both these things, what we will get? We will get the affected part of the myelin sheath, which will lead to the sensation loss. Okay. Now we are going for the epidemiology. The incidence of the TM. What is TM? Transverse myelitis. So from severe to mild, that is 1 to 8 cases per million for 1 year calculation. Okay. So already we have discussed like TM is a rare neurological disorder. Okay. Now going for the people who are getting affected. It affects the adults and the children, both of them. Both the adults and the children are getting into this transverse myelitis. Now we are going for the races, all the races. So how many races we are having in this world? 2 races. One is black race and is white race. So these 2 races people are getting into affected. And now going for the people of the age between 10 and 19 years and 30 and 39 years. So this is the time period in which area the adult and also the children will be getting the affected. Now we are going for the pathology. First of all, before going to the pathology, we need to see this condition is affecting the spinal cord. Yes or no? Yes. Now the inflammation in the spinal cord. Look at this picture. You can able to see. I zoom this. So these areas are normal. Look, this is the spinal cord. And what is this? Vertebra. And what is present inside the vertebra? IVs, intervertebral disc. And this one is the spinal cord, which is passing in the spinal canal. Now you can see this red area. Can you see it? This area is getting inflamed. What causes this inflammation? All these things will be learning in the pathophysiology. Before going to pathophysiology, we go for the physiology of the myelin sheath. Okay? What is myelin sheath? So it is a protective layer, it is a covering. And the main important function of this myelin sheath is transferring the signals. Yes or no? Transferring the signals in the saltatory conduction. Okay? Why? This myelin sheath is getting affected. Okay? When this myelin sheath is going for any infection, okay, this myelin sheath will not able to transmit the signal from one end to another end. Yes or no? Now, going for the pathophysiology. The mechanism of the TM is unknown. Another name of unknown is idiopathic. Okay, idiopathic in medical terms we will be saying as idiopathic. That is unknown. Now, but some cases will be following certain classifications. What and all? First is viral infection, vaccination, and autoimmune reaction. What is autoimmune reaction? This transverse myelitis is an autoimmune disorder. Yes or no? In detail, we are going for the pathophysiology. Okay? Now, first one is the inflammatory process. Now look at this slide. Inflammatory process. What is it? Immune mediated inflammation damages the myelin sheath, and sometimes the axons also going for the damage. Okay, this is the first stage of the pathophysiology.